Now we're going to be assessing the segmental mobility of the AA joint. Now there's a few ways that we're going to assess this based on how specific you're looking to be and also what some of the research says. Now, the test that is used the most for your clinical practice guidelines, your treatment-based classification types of systems, is first the flexion and rotation test. So fully flex the head and then rotate to one side and then the other. And you're just looking for an asymmetry and here the gross type of motion. Jim is a little bit limited looking to the left here. Now, the next method of assessing it is a full side bend and contralateral rotation. Now, since Jim was restricted with that flexion rotation test to the left, we're going to check that here as well. So I'm going to first take the slack off of his upper trap by shrugging the shoulder. I'm going to passively, fully side bend his head to the right, and then while maintaining that, rotate his head to the left. And you can tell he is a little bit stiff right there, okay? Now, the key there is making sure that you're maintaining that full side bend before you rotate, because what I see a lot of people kind of have trouble with is as they're trying to rotate, they end up rotating right out of that side bend. By keeping that full side bend, you are locking out C2 down through C7, and the only rotation can occur at C12 due to the limitation of side bend at that joint. Now, what both those techniques look at is a method of gross rotation at the AA joint. We also want to try and be a little bit specific, looking at latection and rotection. Latection is being specific to where the condyle of C1 is moving relative to the condyle of C2, where C1 is moving anterior relative to C2. So if you think about in your mid-cervical spine, when you open on one side and close on the other with rotation or side bend, the same exact type of motion or conjugate motion happens at the AA joint, in a sense that if you're rotating anteriorly at the condyle on one side, you're going to rotate posteriorly at the condyle on the other side. So as we go through this, I'm going to place my second MCP at the posterior aspect of C1 on the transverse process on each side. And I'm simply going to, since we're looking at left rotation, I'm going to guide Jim's right transverse process or condyle of C1 into an anterior and slightly inferior direction. And I can compare that to the right side. And Jim does feel stiffer with that left rotation there. Now, the joint can also be restricted with a posterior type of motion as well. So to assess this, what we do is we find the posterior aspect of the C2 spinous process, or transverse process, and that's going to be more lateral than you're used to since we're not on the articular pillar. And I'm going to place my index finger and my third digit to block that so that there cannot be any posterior type of motion there at the C2 transverse process. I'm then going to rotate his head through the occiput here, or the forehead, to the left. And what I'm looking for is how much motion is occurring there by allowing the C1 condyle on the left to move posterior relative to the C2 condyle on the left. I'm going to also compare that on the right side. And one more time on the left. And it's a little bit more restricted on this left side, but to me, Jim felt like a greater restriction was noted with the latection on this right side. So think of it going back to the mid-cervical spine. As we would rotate to the left, you would have a opening type of motion on the right side and a closing on the left. Well, for looking at the AA joint, as he rotates left, you're getting latection on the right and rotection on the left, or opening on the right and closing on the left. In Jim's case, the biggest or most notable dysfunction is latection on the right. So I would want to address that with my manual therapy techniques. Now, make sure that you review the manual therapy joint type of assessment that we have the video for, where we're using the anatomical models, just to make a little bit more sense with rotection versus latection for hand placement and also anatomically what's happening.